Vaccinations for your family have long been a standard part of healthcare routines, especially during cold and flu seasons, when parents start thinking about flu shots, COVID vaccines, and other immunizations. Whether it's during a regular pediatric checkup or a visit to a vaccine clinic, getting shots has become almost automatic every fall. But this year, everything feels different, and that unease is understandable. If you're a parent following the news or scrolling through social media, you've likely noticed that the US government has recently altered its vaccine guidelines. This shift has sparked a lot of debate, with many leading medical organizations openly opposing these new recommendations. A number of states are also pushing back by considering their own vaccine policies, creating a patchwork of confusion. As a parent of 3 healthy young children myself, I've wrestled with questions that many parents share. Are COVID-19 vaccines still recommended for kids? Will flu shots be as accessible as before? Will insurance cover these vaccinations? Or are we heading into a realm where coverage becomes uncertain? Amidst all this, it can feel like there's no clear answer about what's safe or even advisable. In the past, these decisions seemed straightforward. The federal government, trusted medical societies, and your personal doctor generally agreed on vaccine recommendations, which were then covered by your health insurance. This straightforward link provided peace of mind. But today, that clarity is fading. Robert F. Kennedy Jr., currently the U.S. Health Secretary, has pushed through considerable changes in vaccine policy on his own authority. Notably, he has declared that healthy children and pregnant women should not receive COVID vaccines, an announcement that has caused major upheaval within the Centers for Disease Control and Prevention, CDC. This turmoil has led several key CDC leaders to resign, including the agency's director, Susan Monterez. To add fuel to the fire, there are talks that the Trump administration may completely withdraw COVID vaccines from the market. Kennedy is also overseeing a comprehensive review of the entire childhood vaccine schedule and has placed vaccine skeptics in prominent government roles. This upheaval has ignited strong resistance from the medical community. Recently, the American Academy of Pediatrics and the American College of Obstetricians and Gynecologists have publicly affirmed that children and pregnant women should still receive the COVID vaccine, standing in opposition to the government's changed stance. Beyond individual organizations, some states on the West Coast and in New England are collaborating to craft their own vaccination guidelines. Massachusetts, for example, is taking steps to make sure state-endorsed vaccines are covered by health insurers, paving the way for other states to follow. So, what does this mean for vaccine access right now? The Trump administration has granted limited approval for updated COVID vaccines, excluding healthy adults under 65 and children from this authorization. It's unclear how available these vaccines will be at pharmacies or doctors' offices as we enter the fall season. The CDC is expected to release its own guidance later this month, which might align with or diverge from the FDA's stance. We are navigating unfamiliar waters. Currently, other routine vaccines have not been directly affected, but Kennedy's willingness to deviate from traditional vaccine review processes raises concern. Potential changes to who should get flu shots, RSV vaccines, and even long-standing immunizations like those for measles or hepatitis could be on the horizon. This sets up a challenging situation when government vaccine recommendations contradict professional medical organizations. What is a parent to do? The first step is to familiarize yourself with reliable sources. Despite the conflict, keeping an eye on CDC guidance remains valuable. In parallel, pay attention to recommendations from respected medical associations like the American Academy of Pediatrics, the American College of Obstetricians and Gynecologists, and the Infectious Diseases Society of America. You are not alone in this maze. Your family doctor, primary care provider, or pharmacist should be trusted partners who can help you interpret the latest advice. They can also update you on any policy shifts and the reasons behind them. When there is agreement between the CDC and medical societies, such as might be the case for flu vaccines, you can confidently get those shots, knowing that insurance is likely to cover the costs, since federal law requires insurers to pay for federally recommended vaccines. But when experts disagree, like they currently do over COVID shots, having a healthcare provider you trust becomes even more critical. Unfortunately, finding a primary care doctor in the U.S. is increasingly difficult, leaving some families without easy access to professional guidance. However, even a nurse at a pharmacy or a healthcare worker at a vaccine clinic can be a valuable resource. Don't hesitate to ask them, what benefits does this vaccine provide? What risks are involved? How common are serious side effects? And importantly, do the benefits outweigh the risks in their professional opinion? They can also clarify which vaccine brands might be preferable. For instance, the Pfizer vaccine is approved for children aged 5 and older, while Moderna can be given to kids as young as 6 months. Another pressing question many parents face is the cost of vaccines in this evolving landscape. Insurance coverage remains largely consistent for now, but that could rapidly change with shifting federal policy. Your doctor often handles insurance claims and can advocate on your behalf if coverage is unclear. They might also be aware of state mandates that require insurers to cover vaccines or alternative programs that help with costs. Recent FDA approvals do still allow children with underlying health conditions to receive COVID vaccines with a doctor's recommendation, which might help ensure insurance coverage in those cases. Adults with certain medical conditions, such as asthma, diabetes, heart disease, mental health issues, or immune deficiencies, may also qualify under the new criteria. Healthcare decision-making isn't as straightforward as it once was, but your most important allies are your healthcare providers and yourself. Gathering trustworthy information, building a relationship with a trusted doctor, and asking the right questions can empower you to make confident, informed choices for you and your family's health. Here's a final thought. In this divided climate, how should we weigh government guidance against the recommendations of medical experts? Are we prepared for a future where vaccine policies differ vastly from one state to another? What does this mean for public trust in vaccines and health authorities? Your perspectives matter. Do you agree or disagree with the current shifts? Join the conversation and voice your thoughts.